Hey, welcome back to the podcast. Today, I want to talk to you about efficient access to care and some of the ways that you can combat this if you're struggling with access to care. And if you feel like you are not alone. Of course, we know that good access to quality health care improves health outcomes by allowing you to get an earlier diagnosis and treatment plan, quicker recovery, and avoid some of the common pitfalls associated with your disease process. Unfortunately, though, most Americans have faced some challenges at some point in their healthcare journey with accessing care, and there's a lot of reasons for that. One of the most common ones that comes to mind is provider shortages. We've talked about this before, but the healthcare system is really overburdened right now, with people needing care and not enough providers, meaning doctors, nurses, therapists, etc., to give that care. Unfortunately, this is not something. There's not an easy solution to the sheer volume there, and of course, there's a lot of things that go into it. However, just looking at the numbers, even if we lost none of our workforce right now, our population is aging. So from here, I think I've shared this before, but from here until 2030, every single day, the AARP tells us that about 10,000 Americans are going to turn 65. Our baby boomers are getting older. And, typically as we age, our health starts to decline and we need more and more care. So, even outside of any other factors that influence healthcare, such as, diet and food and the drugs that are going out, and I mean prescription drugs, medications that people are on, illnesses that we're treating that people are living longer with, even outside of all of that, just the sheer volume of people who are aging right now is putting a significant burden on our healthcare system. And then that doesn't even take into consideration the amount of providers that have left the bedside or have gotten out of acute care and into other different specialties, for a variety of reasons. So at that, the number game right there of providers to patients is a very complex issue, that perhaps we could dive into another episode. But that's one of the number one challenges in getting good care. Right behind that, though, we have some administration issues. How many of you have run into a time where you've had trouble getting an appointment you need because of insurance or a referral process or trouble with scheduling or lack of communication back and forth? I mean, it can be absolutely exhausting. I actually just went through this firsthand with my kids, switching them to a new pediatrician. Part of the reason that we left our previous pediatrician was communications and scheduling and just issues within that practice. Um, I had to get the records to the new pediatrician, and I had to just keep calling to see if they had received the records and calling the old pediatrician to again, get the ask for it to be faxed. I faxed the requests myself several times, in addition with the new pediatrician faxing the request. When I finally was able to make the appointments for my kids, the new pediatrician, I actually looked back at my phone and looked at how many times I had called them. And I called the new pediatrician's office 18 times, checking on record status and trying to get these appointments made. That was so frustrating. I didn't even go back and count how many times I had called the other office. And then there were some other things too. So certainly there can be some significant, like, administrative, frankly, BS that weighs down the process of getting access to care, that unfortunately you need to be aware of and prepared for. And we'll talk about that a little bit more in a few minutes. One of the other significant challenges that I see, though, with access to care is that unfortunately, right now, a lot of people view emergency departments as their main access point for care. And that's not a great plan if we can avoid it. And again, that's a multifactorial issue. We can't go into every piece of why that's happening. But I want to bring some awareness to try to avoid that as much as possible. Guys, the ERs are totally overcrowded, and they truly are intended, as the name implies, for true medical emergencies. So they should be, if you are going there seeking treatment that is not a medical emergency, you can expect that you are going to have long wait times, probably not the quality of experience that you want, depending on what's going on with you. You may not even get the answers that you're looking for, but I can almost guarantee you, you will receive a hefty bill for it. So again, we'll talk about some alternatives in a few minutes. Now, all of these things, the provider shortages, ER overcrowding, and administrative burdens of accessing healthcare in the first place, of course, they take a physical toll on your health. You may have experienced this yourself, but the longer you go without a diagnosis and therefore appropriate treatment, the longer that disease process is taking hold and having a negative effect on your body. This, of course, not only is this not as good for your health, but it imparts a financial toll as well, both on the finance of a longer treatment period, whether that be time in the hospital or just more medication that you need to take. Sometimes if you wait too long to go to the hospital, then you end up being in the hospital for a while, then you end up having to go to rehab to get your strength back because you got to such a point of deconditioning before, we kind of got the tide to turn. Or perhaps it's through loss of work. You couldn't get treated in a timely manner and you were sick for so much longer and now you've lost wages. So these are some of the big impacts on your health and your finances. And then, of course, it affects you mentally and emotionally. Nobody wants to be sick or ill or, having a flare up of their condition. That doesn't feel good physically or mentally. And it also serves to erode any trust in the healthcare system. It starts to feel like nobody cares about you. And I just want to implore you for a minute. I have worked with so many providers in the healthcare system over the years, and I have to say that, of course, there's a handful I'd prefer never to work with again. But for the vast majority, these providers do care about you, and they are frankly getting as chewed up by the system as you are. So I just want to put that out there, that oftentimes it's not anything personal against you. It's actually what you're feeling is the impersonal effects of this huge just healthcare system that it's not working well to serve the people it's actually supposed to serve. Um, and that's why I am so passionate about this podcast. And that's why I've titled it How to Survive Healthcare, not how to get through it, not how to navigate it, not how to get the most about how to survive it, because that's really the state that it can get to. And I see that and I hear you and I am with you. And that's why it's so critical to me to get this knowledge out to everybody, because you can't rely on the system to just take care of all of the things that you need. It's unfortunate. And as we move into solutions for some of these things, unfortunately, really my number one solution I have for you is you have to be prepared to fight. And this is also why I say you really need to have a dedicated advocate with you whenever you're interacting with the healthcare system, because it is so hard to try and stand up and fight for yourself at the same time that you are sick, injured, in a flare, disease state, not thinking properly, overwhelmed, confused, all of those things. You have to have somebody with you. At the very least, a spouse, partner, adult child, other close family member, best friend, neighbor, or at best, a professional advocate, but somebody alongside you to help take the burden of the fighting to make sure that you get the care that you need, because it's there. It is there. You can absolutely get access to the care. It's just, how many hurdles are you going to have to jump over before you can get to it? And that's the frustrating part. And I really wish it wasn't that way. And I don't I don't know how or when it will get better. You do hear, a side note, slight tangent, you do hear topics of, people discussing universal health care, and it's a great concept. But honestly, if you go back to some of the challenges I outlined a few minutes ago with provider shortages and administrative barriers and ER overcrowding, expanding healthcare coverage to everybody is not going to solve any of those issues. In fact, it's actually going to um, just make them exponentially worse. So while covering care coverage for everybody is an excellent philosophy, I think if something along those lines does move forward, we're just going to see more challenges with access to care. And that's something, I mean, I don't know, I don't really leave this country, but it is something that I have heard about from other countries that do have a broader healthcare coverage, is that they struggle with the access to care. It's like you have healthcare in theory, but if you actually need it, good luck, because there's, again, not enough providers. The system is overburdened. And so I don't hang my hat on that being the solution. I do not know what the solution is. I do firmly believe that independent patient advocacy is a solution, because by working with an advocate, they are able to, someone like myself is able to do all of this heavy lifting on your behalf. And oftentimes, that they're the expert. I know how to get through the system, and it's not something that's, so simple and clear cut. There's not a magic word like, oh, call your insurance company and say this thing and then everything's fine, right? Like it's very, the challenges that each person faces is different for each person. It has to be approached in a different way. It really requires a depth of knowledge to being brought to the table to be able to kind of think complexly around the situation and start to come up with some sometimes out of the box solutions. But there are some things that kind of across the board, I can share with you and recommend that you consider, try out, but you have to be prepared to fight. It doesn't even feel right saying that, honestly, because it's so exhausting. And, I know I've shared before, that's part of the reason I started this business. I had a pretty bad healthcare experience myself, and I was pretty poorly mistreated, frankly, by the healthcare system. And I found out firsthand how difficult it is to navigate, to deal with all of the red tape, the bureaucratic BS, and to figure out what to do to get the care that you need. It's so hard to do that when you're the one that things are happening to. So please find yourself an advocate, somebody other than yourself who will walk this walk and fight for you, because It's just absolutely critical. So as you're going through and trying to figure out how to navigate through these provider shortages and the hoops that insurance puts in front of you and where to go, the ER and whatnot, a couple things to keep in mind. So one thing that has popped up in recent years is telehealth. And telehealth, I'll say there's a time and a place for it. And it's not a solution for everything, and it's definitely not a solution for everyone. You know, we just mentioned a few minutes ago about the baby boomer generation, and how that entire population is aging and their healthcare needs are growing with that. Um, you know, by and large, there are plenty of baby boomers and other older adults who have adapted to technology very well, but the majority are not comfortable with it, or oftentimes feel that it is another barrier to care. However, there is a segment of the population who is very comfortable with technology, no matter what the age. There's also young people who don't like technology. Um, but for those people who are comfortable utilizing technology, then telehealth can be a great option. And actually, a lot of insurances are covering telehealth services at either very low or no cost. And these things can be great options for some things that you would typically go to a primary care or sometimes an urgent care for. They can also be really great options for follow ups, because a lot of times, you know, most of the time you go to see the provider, you get some sort of treatment, and then you get better. They still want to see you in follow up and make sure everything is okay. But oftentimes that follow up maybe doesn't necessarily need to be done in person. So that's just something to keep in mind, because that helps them to be able to see more people in a day and start to address some of this provider shortage. It also, if it's appropriate, it can be an easier appointment for you to not have to go anywhere. And again, a lot of times the coverage that insurance provides on these things can be lower cost than an in-person or potentially free. So just something to think about. Again, it certainly is not a one size fits all. Again, though, on the topic of technology and how it can be helpful to improve, a lot of people's health portals now have messaging options and appointment scheduling through the portals. This, for the people who are comfortable with it, can be helpful. It can be difficult when you're leaving messages, you calling, for instance, your primary care. Maybe you call the office and you leave a message on the line. You don't know when somebody might listen to it, or if they listen to it and maybe forgot to call back. There's been a lot of times I've left those messages and never gotten a call back. The communication loop there is not always a closed loop. I have found personally that using the messaging through the portal, oftentimes you get better response time, and it typically you get a response more often than you do by phone. So that can be helpful when you just have some questions. Maybe you don't feel like you need a whole appointment, but you need somebody to answer your questions better than a Google search. That can be a great option to keep in mind as well. I also, it's very important to know where to go. And this is actually, that's a campaign put out every year. I can't remember actually the time of year that they do it. I feel like it's around this time, but it's a great time to bring it up, because as we are moving into the colder months, well, I thought we were, but if you're anywhere like near me, it's like 80 something degrees today. We're getting I don't know, do they still call it an Indian summer? But we had a frost like on Monday, and now it's Thursday and we got a high of 82. It's wild. But anyways, as the weather fluctuates and we are moving into fall and winter, people do tend to get sicker. The hospitals tend to get a little bit fuller, and these issues of ER overcrowding tend to get worse. So some things to keep in mind there. Know where to go means okay, I have a problem. I needed to be treated in a timely manner, but is it most appropriate for me to go to my primary care, my urgent care, or the emergency room? Um, it's always best to go to the lowest level of care that's appropriate for your condition. So, what do I mean by that? Some people, there's a lot of people who believe that whatever the problem is, just go to the ER and they can fix it. And number one, that's not true. So, an emergency department, as I mentioned, the name applies, is really built for and equipped to screen for and treat life threatening emergencies. Um, that being said, they do not have the capability to screen for and treat every condition under the sun. If it's a lot of times, over my career as an ER nurse, I'll be very frank with patients when they come in, particularly if they have something that's been kind of ongoing for a while, and maybe they've gone to their primary care and gotten some basic testing that really didn't show anything. Honestly, there's probably not much more that the ER is going to be able to provide them other than perhaps some symptom relief in that immediate time, but probably not going to be able to get to the root cause, because often you need to get to a specialist for those things. Now, sometimes people come to the ER because they don't have a primary care, or they can't get in with their primary care. And that again goes back to the challenge of provider shortages. I know I've certainly had times where I can't even get a hold of my primary care. I have a new one now. So if this is, consider this your not your red flag, but if you don't have a primary care, or you don't have a good relationship with your primary care, this is your sign. Find a primary care now, because if you wait until you're sick, which you will get sick at some point, be as a human body on this planet, if you wait until then, you're going to totally bypass the window. You always want to try to go to the primary care first if it's appropriate, because they're the ones who are the most familiar with your medical history. And as things develop for you, the primary care really is ideally the hub that brings all the specialists together. Now, sometimes that doesn't always quite go the way that it's supposed to, but that is the way it's supposed to work. So having a established relationship with a primary care is a great thing. It's also one of your cheapest appointments, and typically should be one of the easiest ones to make. Most primary cares do have same day or next day sick appointments. So what does that mean? Like, if you're sick and you already have seen that provider, you are a patient of that primary care, they typically can see you in their office, again, that day or the very next day. They reserve appointments. Sometimes that's not always the case, but it is typically going to be your easiest and cheapest healthcare option. Now, of course, not everything is appropriate for a primary care. I have a really helpful tool that I've created. It's just a one-page kind of outline of how do you decide where to go. And I've actually done a whole nother podcast episode on that. But if you would like to get that sheet, highly recommended. Download it, print it out, stick it on your fridge. That way you're ready with the information the next time that you do somebody is feeling under the weather or has some sort of an accident or injury or whatnot. So you can go to herdforlife.com, HEARDFORLIFE.com/know, and that's KNOW, as in know where to go. There's a little sign up for my mailing list. You'll also get my free Health Hub tool. And then that worksheet, the Know Where to Go worksheet, will pop right up. So knowing where to go is very helpful. Going to the ER for non-emergent things, as I mentioned, you may not necessarily get the answers that you're hoping for. You certainly are going to be waiting. So In an emergency department, they utilize what's called a triage system. So that means that they are going to be focused on and serving the sickest patients first, not the order in which people sign up. It's not a deli counter. So oftentimes, if you are somebody who is not experiencing a life threatening emergency, is not in some sort of a high risk scenario, has something that's very kind of more a minor illness or injury, a twisted ankle, a cut that needs a couple stitches, maybe just feeling a little dehydrated because you're working outside too hard, or something minor like that. It often means that you're going to have extended wait times, or cough and cold symptoms. That's something we see a lot now that don't include things like chest pain or shortness of breath. So those are things that typically can be treated in an urgent care, and that also means they're going to be deprioritized in an emergency room. So you may come sign in and say you're having just kind of stuffy head, runny nose, generally feel unwell type of symptoms. But you're not having any trouble breathing, no issues with your vital signs, anything like that. Well, everybody, even if you sign in right now and nobody else is in the waiting room, anybody else who's coming in through the front door or through the ambulance who has a higher priority of health crisis going on, they're going to get the attention before you. Whereas if you had went to an urgent care where their whole focus is just on treating people in kind of more that minor illness or injury, you're going to get in that kind of deli line style where you take the ticket, and when it's your turn, you're going to get treatment. You're not going to be continually getting bumped and bumped and bumped to the bottom of the line by people who are having life-threatening emergencies. So that's just some of the things to keep in mind. And then, of course, the cost. Of course, it's different for every insurance, but typically speaking, for most insurances, it's either free or cheap to go to your primary care. It costs a little bit more to go to your urgent care, and then usually it costs quite a bit more to go to the emergency department. So not only is utilizing the lower level of care going to save you time and frustration, it's going to save you money too. That being said, if you're having any signs of a life-threatening emergency, which again, I do go over in detail on that worksheet, of course, the emergency department is the appropriate place to go. But always, 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 as I know I've mentioned before many times and in this video today, have somebody with you who can help to fight for you on your behalf. If that's something that you're interested in getting professional help with, please reach out to me. That's exactly what I do. I love to be able to help you with whatever challenges you're having, either with just providing you a little bit of guidance or actually working one-on-one with you through the challenges. So reach out, heardforlife.com, or wherever you're listening to this podcast. There's usually some sort of a commenting or messaging feature. So thanks for listening today. I hope this was helpful for you. I know I've driven it home a lot. Find yourself an advocate and make sure you have a primary care, and get the Know Where to Go worksheet, heardforlife.com/know. All right, guys, I will see you next week. Take care.